When the first wave of the coronavirus pandemic hit New York City in the spring, its hospitals were quickly overwhelmed. A field hospital was set up in Central Park. The city's conference center was turned into a makeshift hospital, and refrigerated trucks were brought in to help ease overburdened morgues. By the summer, the worst had passed. But now, New York City is experiencing a second wave, with the number of coronavirus cases marching upwards.
New York City has been extraordinary. The way we came back from being the epicenter of the crisis to being one of the safest places in the country, we got to keep it that way. We got to fight back this second wave.
In this second wave of the pandemic, New York City hospitals aren't overwhelmed like they were in the first wave. That's in large part because doctors now have a better understanding of how best to manage the virus. Patients are being admitted earlier and are spending less time in hospital.
But there are concerns about certain pockets of the city with particularly high infection rates.
Staten Island is a problem.
New York's governor says hospitalizations in the borough of Staten Island have tripled over the past 3 weeks.
Remember when we had to set up field hospitals, emergency hospitals for additional capacity? Well, that's what we have to do on Staten Island.
In the Bronx, healthcare workers are calling for more personal protective equipment and staffing.
All the nurses behind me want behind me is staff. They want staff and PPE.
With cases rising simultaneously all across the United States, the pool of traveling nurses has been stretched thin. Despite the challenges, healthcare experts believe they are better prepared this time around for an influx of patients.
We have contact tracing in place. We have way more testing. We'll get results way quicker. So I think we have some tools in our tool belt this time around to, control any sort of mini outbreaks.
The big test comes in the following weeks as Americans head into the holiday season. Families have been advised not to gather with distant relatives for fear it could trigger greater numbers of positive cases. How the hospitals fare greatly depends on whether they follow the advice. Karina, CGTN, New York.